Hi, good morning. My name is Brittany Martin. I am one of the FEP marketing representatives here at Blue Cross Blue Shield of Louisiana Federal Employee Program. Today, I will present on Blue Cross Blue Shield FEP Dental. Blue Cross Blue Shield FEP Dental is a supplemental FEP dental plan. The Federal Employees Dental and Vision Insurance Program, also known as FEP, is a voluntary member pay all dental and vision insurance program. It is offered by the U.S. Office of Personnel Management, also known as OPM. Smiling with confidence. That's the benefit of Blue. Your smile says a lot about you. That's why Blue Cross Blue Shield FEP Dental offers comprehensive dental coverage for federal employees, USPS employees and their families, federal retirees, USPS retirees and their families, retired uniform service members and their families. Today's agenda: why get dental coverage? Blue Cross Blue Shield FEP dental benefits, the 2024 premiums, enrolling in coverage, Blue Cross Blue Shield FEP dental tools and resources, savings and discounts. Why get dental coverage? Pay attention to your oral health. Untreated dental decay is the most common disease in the world that can't be spread person to person for both adults and children. Pregnant individuals with gum disease are more likely to give birth to premature and low birth weight babies. Gum disease may make it more difficult for people with diabetes to control their blood sugar. A sore jaw, along with chest pain, can be a sign of a heart attack. Why do I need dental insurance? Americans with dental benefits are more likely to go to the dentist, take their children to the dentist, receive follow up care, and experience greater overall health. Access to dental care is improved with dental benefits, and dental care improves oral health. Dental coverage is critical for all Americans because there is an ever increasing connection between oral health and overall health. The choice for us as individuals and for our health care system is to pay for preventive dental care now or pay more extensive dental treatment and or potential medical care for dental complications later. What if I don't have dental insurance? Individuals without dental insurance tend to visit the dentist less frequently, missing the opportunity for prevention and early treatment. In 2018, there were over 2 million emergency room visits for dental problems, many of which came from individuals without dental insurance. The importance of good oral habits. Our mouths are full of bacteria, and most of the time, that bacteria is harmless. However, without good oral care, like brushing, flossing, and professional cleanings, that bacteria can take its toll and cause infection. tooth decay, and gum disease. This bacteria can spread to other parts of the body as well and has been linked to secondary infections. Chronic conditions and your oral health. Just as poor oral health can influence overall health, chronic conditions are linked to oral health too. Diabetes may increase the risk of gum disease by reducing the body's natural resistance to infection. HIV/AIDS may cause oral conditions like lesions on the mucous membrane lining inside the mouth. Osteoporosis is linked to periodontal bone loss and tooth loss. One of the possible signs of Alzheimer's disease is deteriorating oral health. Without dental coverage, your oral health and overall health can both be seriously impacted, even if you currently don't have any chronic conditions. Blue Cross Blue Shield FEP benefits. Benefits that make you smile. Fully covered in-network preventive care, including up to 3 dental cleanings a year. No deductible for in-network services. Benefits start right away. There's no waiting period for in-network coverage. An unlimited annual benefit for in-network services under high option. Worldwide coverage with all overseas services at in-network level. Access to health and wellness discounts with Blue 365. We have 2 plans, high option and standard option. Our dental coverage is divided into 4 classes, A, B, C, and D, as well as some general services. Determining your coverage for services. Your level of coverage for dental services is based on the class it falls into and whether the provider is in our network. Class A services. These are considered basic services. These include your oral exams, your sealants, and your x-rays. And new for 2024, we will cover 2 routine oral exams and 1 additional exam if a problem happens between checkups. We previously covered just 2 oral exams. Class B services. These are considered intermediate services. So these will include your deep cleanings, your restorative procedures such as fillings, tooth extractions, and denture adjustments. Class C services, these are considered your major services. They include your root canals, crowns and bridges, and periodontal surgery. What you pay for Class A, B, and C services. So for Class A services, also known as your basic services, again, these will include your exams, your cleanings, x-rays, and sealants. Under the high option for in-network care, you pay nothing. Out of network, you pay 10%. For standard option for in-network services, you pay nothing. Out of network, you pay 40%. Class B intermediate services. These include your oral surgeries, fillings, and gum scaling. For in-network care under high option, you pay 30%. Out of network, you pay 40%. Standard option in-network, you pay 45%. Out of network services, you pay 60%. For Class C major services, these include your crowns, bridges, implants, root canals, and dentures. For high option in-network services, you pay 50%. Out of network, you pay 60%. Standard option in-network services, you pay 65%. Out of network, you pay 80%. For both high option and standard option, classes B and C are covered at 100% for children age 13 and under when visiting an in-network dentist. Class A, B, and C deductibles and benefit maximums. Annual deductible for Class A, B, and C services. High option in network, you pay no deductible. Out of network, you pay $50 per person. Standard option in network, you pay no deductible. Out of network, you pay $75 per person. Annual maximum benefits for Class A, B, and C services. There's no benefit limit. For in-network services under high option. Out of network, under high option, we pay $3,000 per person. Standard option, in-network services, we pay $1,500 per person. Out of network, we pay $750 per person. Class D services, orthodontics. Class D services for adults and children. High option in-network services, we pay 50% up to $3,500 lifetime maximum per person. Out of network, you pay 50% up to $3,500 lifetime max per person. Standard option in network, you pay 50% up to $2,500 lifetime max per person. Out of network, you pay 50% up to $1,250 lifetime max per person. General services. We also cover anesthesia services provided alongside covered surgical procedures, athletic mouth guards, occlusal guards for clenching and grinding, and also new for 2024, we will cover nitrous oxide laughing gas for children 5 and under, as well as other individuals with a medical condition who may require it. Need-based oral care benefits. We offer benefits to meet the needs of all members, including those who may be at higher risk, including a third cleaning when medically necessary, full mouth debridement, one scaling and root planning deep cleaning procedure per quadrant. for periodontal maintenance procedures as well. Blue Cross Blue Shield FEP Dental's network of dentists. We've expanded our nationwide network by 40% over the past 5 years. Coverage in all 50 states and overseas. Nearly 500,000 in-network dentists and their locations. We welcome provider nominations. Easily find a dentist near you at bcbsfepdental.com/find-a-dentist. It pays to stay in network. You can go to a dentist in or out of the Blue Cross Blue Shield FEP Dental Network. But if you see an in-network dentist, both high option and standard option offer preventive and diagnostic treatments. These will include exams, cleanings, x-rays, and sealants, which are covered in full. No calendar year deductible for any in-network services. In-network dentists will submit your claim on your behalf. Coordinating with medical coverage. Your medical plan may include some preventive dental coverage. We'll coordinate benefits on your behalf if you use an in-network dentist in the Blue Cross Blue Shield FEP medical plan and also have BCBS FEP dental. The dental provider can be in or out of the Blue Cross Blue Shield FEP dental network. You need to show both your dental and your member medical ID cards to your dentist. Your dentist will then submit your dental claim to BCBS FEP. You're able to get more details at bcbsfepdental.com/brochures resources. International benefits. If you need to see a dentist while in another country, you're covered overseas. Receive in-network benefit levels. You pay the dentist and then submit a claim to us via secure member portal. English-speaking dentists located in approximately 100 countries. To learn more about international benefits, you can visit bcbsfepdental.com/international services. Visit bcbsfepdental.com/benefits to learn more about our benefits and how dental coverage can help you shine. The 2024 premiums. The 2024 high option premiums. So here in Louisiana, we are in rating area 1. So for self-only biweekly, it is $18.39. Monthly is $39.85. Self plus one biweekly is $36.77. Monthly is $79.67. Self and family biweekly is $55.16. Monthly is $119.51. The standard option premiums, again, we are in rating area 1. Self only biweekly is $9.87. Monthly is $21.39. Self plus one biweekly is $19.75. Monthly is $42.79. Self and family biweekly is $29.62. Monthly is $64.18. You can visit bcbsfepdental.com/premium finder to use our premium finder tool to find your premium. Enrolling in coverage. 3 levels of coverage. BCBS FEP Dental offers high option and standard option at 3 levels of coverage, depending on your needs. You have yourself with self only, you and one other eligible family member with self plus one, you and multiple eligible family members with self and family. Eligibility for federal employees. BCBS FEP Dental is available to federal and U.S. Postal Service USPS employees, annuitants, survivor annuitants, and their families, members eligible for the FEHB. You do not have to be enrolled in the Federal Employees Health Benefits Program. Annuitants receiving an immediate annuity are eligible for dental coverage. Dependent children are covered until age 22. Eligibility for uniform services. BCBS FEP Dental is available to retired uniform service members and their families. Dependent children are covered until age 21, non-students or 23 full-time students. You are eligible for coverage if you were medically retired or if you're enrolled in TRICARE for life. Unmarried surviving spouses and eligible children, dependents of retired uniform service members can enroll. Qualifying life events. Qualifying life events allow you to update your coverage outside of open season. These include getting married, having a baby, losing existing health coverage, losing a family member, and more. Enrolling as a new hire. New hires to the federal government can enroll in coverage up to 60 days from your entry on duty start date. If you do not enroll at this time, you can enroll during the annual open season. Your FEP coverage is effective the first day of the first pay period. Following the date benefits receives your enrollment. Enrolling as a retired uniform service member. Uniform service members retiring or recently retired from service are eligible to enroll in FEP dental coverage. You may enroll either 31 days before your military retirement date and 60 days after or wait until open season. If you enroll before your retirement date, coverage starts on your retirement date. If you enroll within 60 days after your retirement, coverage starts on the first of the month after enrollment. How to enroll. Go online to benefits.com or you can call 1-877-888-3337. Verify your eligibility. Create your benefits account if enrolling online. Provide the requested information. Select the Blue Cross Blue Shield FEP Dental. BCBS FEP Dental Tools and Resources. You're able to visit us online at bcbsfepdental.com. It makes it easy to view important information related to your dental coverage. It is secure and private, as well as access to all our online tools. We also have the member portal. The BCBS FEP Dental member portal gives you access to even more tools and resources designed to keep you informed about your dental coverage. You can sign up or you can log in at bcbsfepdental.com. We recently introduced a live chat feature for you to speak to a representative through the member portal. BCBS FEP Dental mobile app. Our app puts your dental coverage right at your fingertips. In the app, you're able to find an in-network provider. You can nominate providers to join our network. You're able to see your benefits, coverage, and claims information. You can view your digital member ID card and auto replacement cards. You're able to find an event, use an interactive toothbrushing timer. You can also set dental appointment reminders for you and your family. And you're also able to scan this QR code with your phone's camera to learn more about BCBS FEP Dental. And again, you're able to visit bcbsfepdental.com. And if you have any questions, you can call 1-855-504-2583. Available Monday through Friday, 8 a.m. through 8 p.m. Eastern Time. Again, I would like to thank you. And if you have any questions,